Well, the mission of Vista Community Clinic is pretty simple. We provide quality healthcare services and health education to the community, focusing on those individuals that face economic, social, and cultural barriers. We serve 57,000 patients and provide everything from prenatal services, pediatric services, teen and adolescent health, family medicine, and then senior health care as well.
When we provide these kinds of spaces for teens, there's nobody who doesn't benefit from it. Adults benefit from it because teens in places like this are given the tools that they need to become responsible. They're given the tools that they need to really have agency over their own health, right? And that's what they're gonna need when they become adults.
When I decided to come back to Oceanside, a lot of it had to do with the fact that this is home for me. And I knew that I wanted to spend time here and kind of inspire the youth. One thing that working with youth, I always tell my staff that we always have to remember that we're planting seeds. Because there was a time in my life that people were planting seeds in me when I was 12 years old and I was a knucklehead and I didn't listen. But when they told me, hey, if you continue along this path, 5, 10 years from now, X, Y, and Z is gonna happen, just remember what I said.
48 hours after a deadly shooting at an Oceanside park, law enforcement and the community are taking action. They plan to make changes to hopefully prevent more violence. NBC7's Johnny Backus is live at the Oceanside Police Department with this story. Tanya.
Well, Mark, top brass at the Oceanside Police Department and city officials have assessed Libby Lake Park. They say the shooting there that happened on Wednesday that killed 2 teenagers has affected them personally, and they're working to make sure that it doesn't happen again.
Ever since I got shot on March 15th, it made me realize the positive decisions I could make, because decisions is what actually makes a person. But when you're here, it's like a haven, you know, and you just get away from everything else. We live in the hood, in the ghetto, and so sometimes people need a place to come, and so that's why I decided to come.
It's a good place to hang out and have fun, and it prevents kids that live in this area to like just go out, do drugs, do dangerous things.
I feel safe here because, well, we learned like a lot about like what will happen in the streets at night.
Project REACH is a youth development preventative-based program, and it's a mouthful because sometimes people ask me, what's REACH? I'm like, well, okay, so they're like, it's a part of the Vista Community Clinic. I'm like, it is. So you have the Vista Community Clinic, and Project REACH is under its youth development programs. REACH is an acronym for recreation, employment, academic assistance, communication skills, and healthy lifestyles. It's a mouthful, but we do all of that here.
My mentor, Jimmy Figueroa, tells me you can't do it by yourself. You can never do it by yourself. You need help, and everybody needs help. Although they always say, no, I got it. That's not true. It's not true. You need help. And REACH is this help. REACH is how can I put it? REACH is like an angel helping kids.
He's like a role model. He's like, cause he told us our story too the first day he came here, like what happened. And it's like pretty inspiring to hear like what happened, like how he stopped that and started doing this.
Not many people get to live through 7 shots and 1 in the head, you know? And so I take advantage of that, you know? I take advantage of that, and I know that one day I will be something big, and I will come back here and I will get back.
I've seen a lot of changes happen in the 26 years that I've been here, but one of the things that's never changed is the need and the services that are still needed to provide for individuals who either do not have insurance, do not have a medical home, or may be new to the area and don't know where to access healthcare services.
Pediatrics at Vista Community Clinic is important to the community because these folks don't necessarily have another place to not just get their health care, but to get educated about their health. And we really focus on the whole person, the whole child as well as the whole family.
They discovered that he had what's called a severe coarctation of the aortic valve and a severe stenosis. Then from there, it was on that Friday, they told us he needed the open heart surgery. It wasn't even an option of if we do it, it's we need to do this procedure.
One of the risks they said was if we do nothing about it, that he might not make it to 5 years old.
The whole team of us, we know our patients. They're like our family. They feel comfortable with us, and that's so important in getting a quality healthcare outcome.
As he's been growing, he's been getting his immunizations, he's gotten everything that, his pediatrician explains everything very well, what milestones he needs to meet, and he's met every milestone. So it's, you know, it's very great when you can speak to a pediatrician and have her explain things to you in a sense where you feel comfortable.
Approximately 60% of the patients that we see have no health insurance. For many of those patients, they come to us because they have nowhere else to go. And so we see everyone that walks in the doors.
I think the benefit to the community as a whole is that, number one, you have a safe space for teenagers. And when we think about what it is that teens, especially teens who are struggling, and they could be struggling with stuff at school, they could be struggling with stuff at home, they could be struggling with interpersonal social stuff. But when we create a safe space for them where they can come and even just bounce ideas off of somebody, that's great.
I love working at Vista Community Clinic. We provide such a great service to the community, and I can walk home with a good heart every day.
We've been lucky in the fact that we've been able to run those programs for the last 20 years, but it's a lot of hard work because it's looking for grants and then looking for potential donors who are supportive of what we're doing with our adolescents and youth here at the clinic.
I would say that that experience was really helpful because what it taught me was that in every interaction, I have the ability to help make somebody's day better or worse, and that's a conscious decision that I would have to make every single time I would go in. I'm glad to say that the people that I worked with, and in general for the clinic-wide, that's what brought everybody to the table.
I am so happy that I did come here because I don't know what else would have probably happened.
Reach is like academics plus life, and you just put it together, and that's a combination of success.